brand new show called as A Healthy Dose. This is me, Dr. Virinchi Sharma, your host and your dost from today. We will be doing these sessions, and we have a very senior doctor with us, a senior consultant oncologist, Dr. Mallik Singaraju. Let me give you a very brief introduction about Sir. Sir is a cancer specialist currently working with Continental Hospital in the oncology department in Gachibowli. Sir has an experience of about 18 years, treated more than 10,000 people with cancer. Sir has completed his education from the prestigious institute that is the Manipal University and has worked as an assistant professor in the Manipal University. He's the founder of Singaraju Cancer Foundation, involved in several works in regards to cancer and oncology. He has enrolled in the Guinness Book of Records for participation in the largest breast cancer screening camp in 2016. In 2017, he has received Vidya Ratan Award. In 2020, he has been awarded by the Star Gold, and he has received the Vishishta Award in 2021 from the Icon Group. I think after all of this, it's not very easy to bring Sir onto this podium, but thank you so much, Sir. In 2023, you have been our first, guest doctor in this new show, A Healthy Dose. And from the bottom of our heart, we thank you very much for joining us today, Sir. Thank you so much.
Thank you so much, Virinchi, for inviting me to your show.
Thank you, sir. Thank you. And without wasting any time, I would like to take the next 30 minutes of yours in enlightening our audiences about cancer, its awareness, its prevention. So usually, sir, when we talk about cancer, the first thing that comes into our mind, or when we watch a movie or when we read a book, what we usually see is when the doctor says you've got cancer. I think the first question that anybody asks is, what stage am I in? So this is the common question in most of the laymen, non-medical professionals. So how do we usually stage these cancers, and what are they about, sir? I mean, what does it go on like?
See, usually, I want to tell you a basic point about cancer. Usually, most of the people have a lot of misconception about cancer. They think it is acquired from one person to other person. It's infectious disease, or we get it through mosquito bites. So many people keep asking me. It is just nothing but an imbalance in the body. There's uncontrolled growth of cells. That's basically what is cancer. And usually we have cancers from stage 0 to stage 4. Most of the cancers are divided from stage 0 to stage 4, not all cancers. And we use different modalities to diagnose the disease and for staging workup.
Well, thank you. Thank you so much, sir, for that question. Well, sir, you've been working for, the last 2 decades in this department. So do you see any change in the pattern or in the kind of cancers that, people are coming with? I mean, compared to how it was when you started, what do you see right now? Is there any change in the pattern?
Yeah, absolutely. When you're asking about my personal experience, when you look at the data for last 2 decades, the number of cancer patients are consistently increasing, and the number of cancer cases are increasing every year. And being a doctor, you'll be knowing much more than anyone else. And most important point is, more and more patients are being diagnosed at a much younger age, which is very alarming.
Right.
And over a period of time, cancer has become number one killer. So as we are aware, maybe when we're talking about independence and pre-independence era, people used to die with diseases like diarrhea. 1930s and 40s, people used to die with diarrhea. Then again, when it came to 50s and 60s, people started dying of tuberculosis. And later again, 70s, 80s, people were dying of HIV. And later on, from the early 80s to early 90s, it was a peak of HIV and cardiac cases. But now we don't see people dying of either tuberculosis, HIV, and now even the cardiac mortalities have come down significantly. That's because of the awareness programs and availability of a lot of technology. But now cancer is the number one cause of death. And previously, when you asked this thing about 20 years back, we used to listen. Okay, someone got cancer. We heard some relative has cancer, some friend's friend has cancer. But now we are seeing cancer in our own relatives, in our own family members, in our own friends. It has become very common.
Right, very much, sir. Like you said, I think once upon a time, the word cancer was only heard from, distant people where they would talk about somebody diagnosed. But nowadays, I think every family, somewhere in one family, close relatives or distant relatives have cancer. So when we talk about cancer, sir, what are the common cancers that you see in your day-to-day practice?
The most common cancer when it comes to women is breast cancer, followed by cervical cancer. Previously, cervical cancer was number one cancer in India, whereas in Western world, breast cancer was very common. But now breast cancer is number one cancer in women, followed by cervical cancer. Even now, cervical cancer is very common in rural areas and low socioeconomic groups. Again, followed by we have head and neck cancer, with oral cancers and throat cancers, followed by lung cancers. Though lung cancers are very few compared to breast cancer and cervical cancer, lung cancer still tends to be number one killer among cancers. Again, followed by colorectal cancer, intestine cancers, and there's so many cancers following that.
Right, right. So, like some time back, you did explain how in different eras there have been different health issues that have been the causes for death or morbidity. And right now, like you said, cancer is, one of the leading causes or the leading cause. Do you somewhere see the current lifestyles that we individuals are living as a factor that could be contributing to this cancer?
Absolutely. See, when you see the trend of cancers, the type of cancers which are common in urban areas are little different from the type of cancers in rural areas. In urban areas, we see most commonly breast cancers, endometrial cancers, and lung cancers more commonly. Whereas in rural areas, we see cervical cancers, head and neck cancers, and colorectal cancers more commonly. And definitely, lifestyle has significant contribution because now, as you said, your introduction was with the movies. Now, when you go to movie theater, everybody speaks about stopping smoking, tobacco consumption, and alcohol consumption. Yes, absolutely. No, tobacco consumption is associated with almost 80% of all cancers. In whatever way someone consumes tobacco, let it be smoking or hookah or any other way, tobacco definitely causes cancer. And excess alcohol intake also leads to different kinds of cancers like liver cancers and intestine cancers. Similarly, nowadays, no, yeah, sometimes I'll be overlapping your zone being a psychiatrist. Definitely, there's so much common when it comes to oncology and psychiatry. Nowadays, you are seeing more and more youth being addicted to drugs. Even some components which are used in drugs, something like phenylephrine, which is called as cutting agent, that increases the bulk of drug, that also is associated with different cancers. And most importantly, the food we take, junk food, the lot of junk food and colas, which has lot of sugary items and excess calories. It is known that is these sugary items which lead to obesity. It causes 12 different kinds of cancer. Apart from that, very popular packed food. Now, almost all the preservatives contain cancerous elements. And again, nowadays, the smoked food is very popular. Even the breakthrough product of smoked or barbecue smoked food, again, the hydrocarbons are also cause for cancer. Now, apart from that, the most important thing is imbalanced diet. Now, some people consume excess fats, excess proteins, but there is less of fiber, fruits, and vegetables. So, imbalanced diet is one cause. And again, there are different type of infections like human papillomavirus infections, HIVs, hepatitis B infection. All these infections also lead to cancer. And most popularly, radiation coming from mobiles. So in the whole spectrum, I am keeping hereditary in the last. Previously, when 20 years back, when someone used to ask me about the cause of cancer, we used to give blunt answers: smoking, drinking, hereditary. Only three answers we had. But now, after a big array of reasons, or risk factors, I'm bringing hair tree in the last. So
Well,
definitely, it is a lifestyle disease.
well, I think this is very new for me as a doctor also, sir, because a lot of things that we believe we are doing in a healthy way, probably, you know, we are consuming a protein which is packed. We believe I'm eating a healthy protein, but like you said, the preservatives that are used to, keep them for a longer time could also be cancerous.
Yeah,
And
apart from sorry, I'm cutting down your.
please, please.
So apart from that, what since you told that packed food, the chemicals. One more important thing is the chemical exposure. The chemical exposure in the food, what we eat, starting from water to milk, whatever we're eating, the chemical exposure, environmental pollution also a very important factor for cancer.
That's again a very important thing, sir, that you said. And one more point that really struck me, what you said was an imbalance in the food, because nowadays on all social media platforms we see a lot of quacks who are influencers who talk about eat great quantity of protein, cut down everything else, and then you'll start losing weight. And as you know, nowadays weight loss is the greatest achievement which everybody looks at. So somewhere, having an imbalance in the good food that we eat also is what you said can be a cancer causing agent. And another take home, sir, I think, which most of us, again, in this newer generation, and especially the next generation that we are seeing now, who are in the early teenagers, always have the mobile phone or the electronic gadget in their hand, and it is 24 hours in their vicinity. Even when they are sleeping, it is very close by. You spoke about how the radiation is also dangerous. So are you actually seeing any such cases, sir, I mean, where there is exposure to radiation as one of the prominent triggers?
So there have been studies, but since this is a big multi-million business, some reports are not really mentioned out in the public, but there's definitely there is association with excess use of mobile phone and brain tumors and ear cancer.
Right. I think this is again another important point that you said, sir, because nowadays somebody watching this live would first go and check it on Google if there is something there. So I think the audiences should understand that if you don't find it on Google, does not mean it is not true. When we are hearing from an expert, a very experienced oncologist, we need to understand that the market could be hiding it, but the truth is that there is enough evidence which talks about it. Sir, you did speak about mental health. I always, vision this. I mean, an individual sitting in an oncologist's chamber, a patient sitting in the oncologist's chamber, and the oncologist looks at the reports and looks at the patient and says, okay, you have cancer. And I think it's very scary for that person sitting in that cabin. There could be centralized AC, but it's going to trigger a lot of negative emotions in that individual. You have a very sweet body language and the way you talk, so I'm sure your patients must not be feeling that stress, but still the word cancer is stressful. So how often do you need to jump into the shoes of being a mental health advocate also to them, and what is the role of mental health in cancer?
So, very good question, Dr. Virinchi, coming from a renowned psychiatrist. Yeah, breaking the ice is very important when it comes to no disclosing about the cancer. And one more thing, a couple of minutes back, you mentioned about Google. What happens most commonly is, and this is my advice to all the viewers, start stop Googling, listen to doctor, talk to doctor. What happens? They Google about some diagnosis or some report they have in their hands, and they'll get a lot of information which is not related to them. Now, Google gives every information, but it may not be related to them. So before coming to doctor itself, sometimes ignorance is bliss. Before coming to doctor itself, they'll have preconceived notion of all the treatment, side effect, everything. So when I tell no, this is not for you, this is not for you, they'll feel pleasantly surprised actually. Sometimes the counseling part becomes more easy for me. And sometimes, yes, if a patient who is totally ignorant about the disease comes, yes, the breaking ice will take little time. And most of the time, yes, we do need the help of a psychologist. But as you mentioned about the role of mental health, yeah, in the initial part of my conversation, I was talking about the imbalance in the body. So there are different factors affecting the cancer growth in the body. There are certain things like proto-oncogenes are different factors, so many factors, which are, as I mentioned, all the risk factors. They constantly provoke the proto-oncogenes or cancer-causing factors. At the same time, there's something called immunity in the body. Every day, our immunity protects us against the cancer. So, any factor which is lowering the immunity is as good as a risk factor for cancer. So, nowadays, some point will be relatively little new for you, though you may not be totally surprised. Stress is a very important factor which reduces the immunity. And nowadays, because of the work pressure, personal reasons, financial reasons, so many reasons, almost we can say 60% of people are under some kind of stress every day. And apart from that, most important thing which I believe as an oncologist is holding negative emotions. So many people hold negative emotions in them, like anger, resentment, hatred. Holding all these emotions for a longer period will result in different kinds of diseases, including cancer. In most people, that could be one of the most common cause of breast cancer in females. And apart from that, lack of sleep. We are mentioning about mobiles. Yes, this is one of the effect. Lack of sleep also reduces the immunity, and sedentary lifestyle also causes cancer. So there is so much. So actually, we require an integrated approach from psychologist or psychiatrist to take care of an oncology patient. We need an integrated approach here.
I think very well said, sir. I think this is a lot of information that the audiences are taking today, and we have applause coming in the comment section also about some important aspects that you are saying. And you hit the nail in the coffin, sir. You spoke about how stress, because today's world has been educated to a level where they are understanding that stress can be a causative for heart diseases. This people have understood, but people, like you said, the cortisol levels, the stress hormone, once it starts increasing, is worsening your immunity, and that worsened immunity could be a causative factor for cancer. And this is a very important take home to a lot of us watching this, because I think in today's world, the greatest issue has been stress, and we all accept it, especially because we do not know what it is doing inside to the body, because it is not showing some direct effect immediately. We are fine with it. And another important thing that you spoke about, sir, is the sleep disturbance, because as a psychiatrist, what I've understood is the first thing that any individual is ready to compromise is sleep. We would never compromise on food. We don't want to compromise on fun. We don't want to compromise on money. But sleep, it's fine. It can be a wedding, or it can be an exam, or it can be a project. The first thing that we compromise is sleep. And as a psychiatrist, I've always known about the changes that happen in the brain. But like you mentioned, I think a sleep disturbance itself could be leading into some changes in the body, which can lead into cancer. Is something very important that a lot of us are taking home today. Sir, now when we talk about cancer, because you have spoken about the triggers which are there in almost all of us right now, be it sleep disturbances, be it eating preserved food, be it not exercising. So I'm sure all of us must be thinking now, we are all surely at a risk. I'm sure we are all at a risk. So how do you think we should, take this ahead? I mean, there are two things here. One, you spoke about these newer risk factors like sleep disturbances, or you spoke about, lifestyle changes. On the other side, there have been some known lifestyle changes like smoking, alcohol, which people must be doing. So either of the people, how do they approach to understand, where they are, or where their body is, or which stage of illness the body is in?
Yeah, here the most important thing is being self-aware. Now, it's important to understand the symptoms of cancer, even in case to detect the cancer early. We should at least have an idea about the symptoms of cancer. So basically, those symptoms will not be same for everyone. Most of the time, you find some kind of change in the body, some kind of abnormality in the body is definitely there, like sudden change in the voice, or consistent cough, or any swelling in any particular part of body which is growing hard, like lumps in the breast, or unusual bleeding from any part, like when you're bleeding when you're going for stool, bleeding when you're passing urine, bleeding for vaginal. So all these symptoms and sudden rapid loss of weight or persistent fever for 3 months. So and a change in the voice along with cough and blood. So all these are symptoms of cancer, but these symptoms can be because of various other conditions. It can be because of infection, hormonal conditions. It can be because of any symptoms. But first thing is being aware is very important, and also going for a regular screening is also important. The major challenge we find in India is first fear to approach doctor. So they're afraid the what doctor will tell, what investigations he tell. He may tell that I have a disease. So a fear of approaching a doctor. And second, the denial. Again, sometimes I'm entering your zone, and denial is a very important factor. People think, no, cancer doesn't affect me, but cancer can affect anyone. People think, no, no, I'm healthy. It will not affect me. It will affect someone else. So that fear and denial, they are the two factors which are major hindrances for early detection of cancer.
Sir, you did speak about screening. You use the word screening, and sometimes, even on hoardings or when we walk into a hospital, we see the advertisement or awareness about cancer screening. So, what exactly is this screening, sir? Is it like a blood test or is it like an examination? Can you please help our audiences understand what screening
Yeah,
is?
it's a very nice question, Dr. Virinchi. Screening means usually what happens when as I mentioned earlier, there is always imbalance in the body and the cancerous changes happening in the body. So from the time the cancerous changes happen in the body, in the cells, to the real symptoms of cancer, there is a period, at least there's a time period of at least few months to few years. Cancer doesn't happen overnight. Like unlike in the movies, it doesn't happen overnight. There is a lag period of at least 6 months to 1.5 years from the time of changes happen to the evidence of the disease. So if we can catch the disease before that, so we will be detecting the cancer in zero stage, not even first stage, even a zero stage or very early first stage. So that is called screening. So catching the disease before it is evident, before the symptoms are evident. So and luckily screening is available for various cancers like breast cancer, cervical cancers, colorectal cancers, prostate cancers, and oral cancer, which are most common cancers. So when it comes to breast cancers, the guidelines say that from the age of 20 years, every month a female should do breast self-examination. And after the age of 40 years, they should go for regular mammography, at least once in 2 years. If it's normal, at least once in 2 years. But if there are any risk factors, like family risk factors, definitely they should go for mammography at least once in a year. Similarly, when it comes to cervical cancer, we have human papillomaviral test and pap smear test. Where the guidelines say we should start doing screening from 25 years, practically it's not possible, but at least from the age of 35 years or once you start having kids. So after the age of 35 years till the age of 65 years, at least once in 3 years, you should go for pap smear test. So after 65 years, once the previous reports are normal, after 65 years, you don't have to go for further screening. Similarly, for prostate cancer, after the age of 50, 55 years, they suggest we should go for PSA test, prostate specific antigen test, and ultrasound abdomen. But once again, if there's a strong family history of prostate cancer or neither cancer, it's better to go from the age of 50 years. Similarly, for colon and rectal cancers, they advise screening of sigmoidoscopy and coloscopy at least once in 5 years.
I think this is a very detailed explanation. Thank you. Thank you so much, sir. I want to understand about, you spoke about how lung cancers are, more dangerous or, have higher mortality rate. And today's world, we see a lot of youngsters starting getting into smoking or getting into drugs or getting into alcoholism at an early stage. Uh, and otherwise, also, we know there are a lot of people who are dependent. As a psychiatrist, I regularly see people who come with a long history of smoking and drinking. Uh, what suggestion can I give them in regards to the screening, sir? At what age, how many years of exposure to the substance should they be getting the screening done? And what are the kind of screening tests that are available, sir?
For as such, there is no specific screening test for lung cancer, but yes, definitely as and when they stop smoking, immediately the reversal effects are evident very clearly. The risk of cancer decreases significantly, but becoming zero might be difficult. Once they have been smoking for 2 to 3 years, the risk may not be become zero, but at least they can go for either chest X-ray or at least HRCT once in a year. But nowadays, when you go for a master health checkup, now most of the screening tests are involved in master health checkup. So almost all the cancers are covered in the master health checkup and the screening checkups.
Well, I think this is again a very valuable information. So, when we are going for a master health checkup, it could be our organization or it could be our insurance company. When it is providing a master health checkup, we need to make sure that there is some screening also that is happening. So, we can always take an advice of experts like Dr. Malik Garu. And sir, I had another question, and I see a similar question in the chat also. We see Lavanya Garu asking, uh, she says, we have heard that cancer is hereditary. Are there any precautions to be taken to stop passing this to other generations?
Yeah, it's a very good question. Yes, nowadays, first thing, previously people used to ask us, uh, we have a family history of cancer. Will I get cancer? At that time, we used to give very vague answer. Yeah, you might get, you might not. We used to give very vague answers, but now, since last 10 years, we have different kinds of genetic tests available. So which detect almost around 40 to 50 kinds of different cancers. So yes, first thing is better to go for a genetic testing depending upon type of family history you have. And yes, if you're found to have high risk, first thing, as I already mentioned, adapting a healthy lifestyle is very important. Like some people they go for prophylactic removal of ovaries. If somebody is having family history of ovary and endometrium, they go for prophylactic removal of uterus and ovaries. And you have seen Angelina Jolie. She's a very famous actress, and she underwent bilateral mastectomy. Such kind of aggressive approaches may not be practical in our country, but at least if you go for regular screening and adapt a healthy lifestyle, maybe you can prevent cancer to maximum extent.
I think this is great news, sir, because for many years, like you said, we've never used the word prevention or completely able to stop somebody from developing a cancer. But I think this is great news when you say that even somebody with a family history can stop themselves from developing or starting that cancerous growth in their body. And I think this is surely a good news to a lot of audiences that are watching. Uh, Anything else that you would like to tell us, sir, before I ask how easy is it to approach Malik Garu if we come to Continental Hospital? Because I know you are a very senior oncologist, and a lot of audiences must be wanting to ask how do we get your appointments, or how easy is it? What are your available timings in the hospital?
Yeah, I'm available from Monday to Saturday from 9:30 to 5:30 in Continental Hospital. But yes, you asked a very good question, how to prevent and any advice. Yeah, and just coming back, I'm extrapolating the sentences you were told earlier. First thing, most important thing is maintaining ideal body weight. That's very important. Second thing, having a balanced diet. And third important thing, most important thing people are neglecting is exercise. Having a regular physical exercise is very important. People give all the excuses saying that no, I work in the kitchen, I walk, I go upstairs, downstairs, but that is not actual exercise. So we need to have of 40 minutes of voluntary physical exercise at least five days a week. That is called a regular exercise. And similarly, we should stay away from all the bad habits and adapt a healthy lifestyle and go for regular health checkup. And most important, be aware of yourself. Any changes happening in the body, just be aware of them and visit a doctor.
I think this is again a very important point that you have mentioned, sir. Like you said, I think every time, even in my practice, when I tell somebody that you need some physical activity, I hear them saying, "Sir, రోజంతా నడుస్తూనే ఉంటాం sir. ఇంట్లో చాలా పని ఉంటుంది." So I think a lot of us believe that the walking that we do is exercise, but what you clearly said has to be taken in bold letters. Voluntary physical activity, 40 minutes, 5 days a week is something that is important. Sir, another question that I always had in mind, uh, another important, or a scary thing that we expose on a day-to-day basis are soaps, shampoos, and a lot of women, different professions, wear some makeup. Uh, is there a risk of, using these products, and can they also be cancerous?
You are putting me in trouble, Dr. Virinchi. No, actually, I don't see any data regarding that. Now, let us not get into that topic.
Right, right, right. But again, surely I think taking a doctor's advice when we are using any products, because again, the reason why I asked this was, sir, a lot of people get carried away by a celebrity promoting a fairness cream or a particular shampoo. So, I always tell somebody, when people say, I started using this for my hair fall, I say, I would always suggest you to meet a dermatologist before you take a decision about what suits your hair, because on the screen they might say that this stops hair fall, but again, hair also has different qualities, different textures. So that was where I was coming from. But sir, one important question I think to all the audiences, uh, you said you're available from Monday to Saturday. So how easy is it to approach? Because it's again coming from a layman perspective. You walk into a multi-speciality hospital, and there's a lot of fear already once you walk into there. I'm sure a lot of people watching you must have already changed their perspective about the department and how it is going to be. But what would you advise somebody who's
Yeah,
wanting to?
definitely. I will share my number on the chat.
Thank you, thank you, sir.
Thank you,
Uh,
Dr. Virinchi.
I think this is what I wanted to ask today, and understand about cancer. And I'm very sure that Dr. Mallik Singaraju Garu has very simplified about what cancer is, what are the different stages of cancer, how we detect them, and most importantly, sir has highlighted about the kind of lifestyle that an individual should be adapting to make sure that we are keeping ourselves away, pushing the cancer away, even if there is a hereditary element in us. But if there's any questions from the audiences, we are open. Sir is here with us for a little more time, so I suggest the audiences to utilize this time. Before that, while the audiences ask a question, I have a compliment for you from the audiences, sir, where ma'am Archana ma'am says, aiding to the rampant spread of cancer in the present times, this information is highly essential for the public. A big applause to both the doctors for their efforts to spread awareness regarding cancer, and also kudos to their social consciousness. Special thanks to Dr. Mallik Singaraju Garu for the valuable information delivered in simple words. This is absolutely what I feel, sir, because you have made it very simple today, because the word cancer has been very scary for most of us. As a doctor, I think, be it chemotherapy in pharmacology or in pathology, we've always kept it away. We were always scared to read those topics. I wish I had a teacher like you when I was a student, but I'm so happy to have connected with you today, sir. Uh,
Thank you.
any final words from you, sir?
I think just one more thing, as I said earlier, do not try to hold on to negative emotions for longer time. Try to find someone, some therapist or some friend or relative with whom you can share your emotions and try to keep your mind light, and try to stay happy.
Thank you, sir. Thank you. I think these are such valuable words. You have spoken from the psychiatrist perspective also, and I'm very grateful for that, because when somebody as senior as you talks about mental health, I'm sure it goes into the brains of individuals. So thank you so much, sir. Thank you for giving us this valuable time and this valuable information.
Thank you,
And
Dr.
I would
Viren.
love to request you to come back to our show very soon with another interesting topic, sir.
Thank you, Dr. Viren.
Thank
Thank
you
you.
so much, sir. Thank you.